When recording respiration, the nurse should option A, inform the patient, option B, count after telling the patient, option C, count without the patient knowledge, option D, take while patient talks. The correct answer is option C, count without the patient knowledge. Respiration should be counted discreetly because patient may alter breathing if they know it is being observed. The temperature measured under the tongue is called option A, rectal temperature, option B, oral temperature, option C, axillary temperature, option D, core temperature. The correct answer is option D, oral temperature. Temperature taken under the tongue is the oral temperature commonly used in adults. The temperature measured under the tongue is called oral temperature. Which pulse site is used for emergency assessment in children? Option A, radial artery, option B, carotid artery, option C, temporal artery, option D, dorsalis pedis artery. The correct answer is option B, carotid artery. In children, the carotid artery is checked during emergencies to assess cardiac activity. Pulse site is used for emergency assessment. The term febrile refers to option A, without fever, option B, with fever, option C, low temperature, option D, cold sensation. The correct answer is option B, with fever. Febrile means having a fever, while afebrile means without a fever. Febrile means having a fever, afebrile means without fever. The condition of difficult or labored breathing is called option A, apnea, option B, dyspnea, option C, eupnea, option D, orthopnea. The correct answer is option B, dyspnea. Dyspnea means difficulty in breathing, often seen in conditions like asthma or COPD. Condition of difficult or labored breathing is called dyspnea. Can see in asthma or COPD. What is the normal pulse pressure in adults? Option A, 10 mm of Hg, option B, 20 mm of Hg, option C, 40 mm of Hg, option D, 60 mm of Hg. The correct answer is option C, 40 mm of Hg. Pulse pressure. Difference between systolic and diastolic blood pressure is normally about 40 mm of Hg, that is 120 minus 82 is equal to 40. Which pulse site is located at the top of the foot? Option A, radial artery, option B, femoral artery, option C, dorsalis pedis artery, option D, popliteal artery. The correct answer is option C, dorsalis pedis artery. The dorsalis pedis pulse is found on dorsum of the foot, used to assess peripheral circulation. Which pulse is felt behind the knee? Option B, radial artery, option B, brachial artery, option C, popliteal, option D, femoral. The correct answer is option C, popliteal. The popliteal pulse is located behind the knee, used to check lower limb blood flow. Popliteal pulse is felt behind the knee. Which pulse site is located in the temple region? Option A, temporal artery, option B, radial artery, option C, carotid artery, option D, femoral artery. The correct answer is option A, temporal artery. The temporal pulse is felt in front of the ear on the temple region of the head. When measuring blood pressure, the first tapping sound heard is option A, diastolic, option B, systolic pressure, option C, mean arterial pressure, option D, pulse pressure. The correct answer is option B, systolic pressure. The first cough sound heard while deflating the cuff represent the systolic pressure. When measuring blood pressure, the last sound heard indicates option A, pulse pressure, option B, systolic pressure, option C, diastolic pressure, option D, mean arterial pressure. The correct answer is option C, diastolic pressure. The disappearance of sound, fifth cough sound, marks the diastolic pressure. The blood pressure should be measured with the arm. Option A, below heart level, option B, above heart level, option C, at heart level, option D, extended above the head. The correct answer is option C, at heart level. For accurate BP reading, the arm should be at the same level as the heart. The blood pressure should be measured with the arm at heart level for accurate reading. The normal temperature range in Celsius is option A, 35 degree Celsius to 36 degree Celsius, option B, 36 to 37.5 degree Celsius, option C, 38 degree to 39 degree Celsius, option D, 37.5 to 39 degree Celsius. The correct answer is option B. The normal human body temperature is 36 to 37.5 degrees Celsius. Which of the following can cause falsely low BP reading? Option A, small cough. Option B, large cough. Option C, tight cough. Option D, patient anxious. The correct answer is option B, large cough. A too large cough may not compress the artery enough, giving a falsely low BP reading. Large, which vital signs is usually measured first? Option A, pulse. Option B, temperature. Option C, blood pressure. Option D, respiration. The correct answer is option B, temperature. In most nursing procedure, temperature is measured first, followed by pulse, respiration, and BP. Temperature is the first vital signs measured during nursing procedure. Which condition is characterized by a body temperature above 40 degrees Celsius? Option A, fever. Option B, hyperparexia. Option C, hypothermia. Option D, subnormal temperature. The correct answer is option B, hyperparexia. Hyperparexia is an extremely high fever when body temperature exceeds 40 degrees Celsius. What is the medical term for low body temperature? Option A, pyrexia. Option B, hypothermia. Option C, hypothermia. Option D, febrile. The correct answer is option B, hypothermia. Hypothermia refers to abnormally low body temperature below 35 degrees Celsius. Hypothermia is a medical term for low body temperature. Which of the following can cause bradypnea? Option A, exercise. Option B, sleep. Option C, fever. Option D, pain. The correct answer is option B, sleep. Sleep slows down body metabolism, leading to slower breathing, that is bradypnea. The respiratory rate in tachypnea is option A, less than 12 breaths per minute. Option B, 12 to 20 breaths per minute. Option C, about 20 breaths per minute. Option D, 10 breaths per minute. The correct answer is option C, about 20 breaths per minute. Tachypnea means rapid breathing, usually more than 20 breaths per minute in adult. Which factor increases the body temperature? Option A, fasting. Option B, exercise. Option C, sleep. Option D, cold exposure. The correct answer is option B, exercise. Exercise increases metabolism and heat production, raising body temperature. Exercise increases body temperature. The artery used for checking BP in the thigh is option A, brachial artery. Option B, femoral artery. Option C, popliteal artery. Option D, radial artery. The correct answer is option B, femoral artery. The femoral artery in the thigh is used when upper arm measurement is not possible. The femoral artery in the thigh is used when upper arm measurement is not possible. A pulse deficit occurs when option A, apical and radial pulse are equal. Option B, apical pulse is higher than radial. Option C, radial pulse is higher than apical. Option C, both are absent. The correct answer is option B. Pulse deficit means the apical pulse exceeds the radial artery, often seen in arrhythmias. The normal oral temperature in Fahrenheit is option A, 97 to 99 degree Fahrenheit. Option B, 95 degree to 96 degree Fahrenheit. Option C, 99 to 101 degree Fahrenheit. Option D, 100 to 102 degree Fahrenheit. The correct answer is option A. The normal oral temperature range is 97 degree Fahrenheit to 99 degree Fahrenheit. That is which pulse site is checked in CPR for adults? Option A, radial. Option B, carotid. Option C, femoral. Option D, temporal. The correct answer is option B, carotid. During CPR in adults, the carotid pulse is checked for 5 to 10 seconds to assess circulation. Cardiopulmonary resuscitation. The abbreviation TPR in nursing stands for option A, total pressure rate. Option B, temperature pulse respiration. Option C, temperature pressure respiration. Option D, total pulse rate. The correct answer is option B. TPR is the standard abbreviation for temperature, pulse and respiration, which are primarily vital signs. Thank you all.